Welcome to our channel Medico's Learning Decks. Here we will discuss easy mnemonics, high yield topics and integrated revision of topics related to medicine. So let's start. So today's topic is hypersensitivity reaction and its types. Okay, it will be a quick revision of all the types of hypersensitivity reaction, and I will give mnemonics how to remember the diseases in different types of hypersensitivity. Okay, so let's start. To first types of hypersensitivity reactions. Okay, there is type 1, type 2, type 3 and type 4, and newly found type 5 also, which I will speak on later on. Okay, so type 1 is humoral mediated, type 2 is also humoral mediated, type 3 also humoral mediated, but type 5 is cell mediated. So which immune response is altered in type 4? It is cell mediated immune response. All other three will be humoral type of immune response will be there, and this is the only one which is delayed immune reaction will be there in type 4. Okay, so now let's see what are the mediators. In type 1 it will be IgE mediated reaction will be there, IgE mediated hypersensitivity. In type 2 it will be IgG mediated hypersensitivity, and in type 3 it will be complex body, that is antigen antibody complex mediated hypersensitivity reaction will happen. And in type 4 it is the delayed type or cell mediated type. So what cell is it mediate? That is T cell mediated hypersensitivity reaction. Okay, T cell mediated hypersensitivity reaction. Now what is the effector mechanism? What is the mechanism of this hypersensitivity reaction in each type? In type 1, as it is IgE mediated, it will be mast cell degranulation will be occurring. Okay, in type 2 it will be complement mediated cytolysis. In type 3 also there will be complement activation and an inflammatory response will happen. Okay, and in type 4 it will be T cell mediated, that is it will lead to macrophage activation leading to phagocytosis or cytotoxicity. Okay, now we will see what are the examples, that is what falls under this category of each type of hypersensitivity reaction, and we will see a mnemonic also how to remember them. Okay, for now let's see the examples. In type 1 we have anaphylaxis, we have asthma, we have atopic dermatitis, that is all the IgE mediated responses. Asthma we see IgE elevation. So these all come under type 1 hypersensitivity reaction. In type 2 what do we have? Goodpasture syndrome, pernicious anemia, transfusion reactions will be there. Okay, in type 3 we have HSP, we have PSGN, we have rheumatoid arthritis, we have lepra reaction too. Okay, and in type 4 we have all the cell mediated reactions, that is the tuberculin test, contact dermatitis, granuloma formation. We see in granuloma formation in tuberculosis and also lepra reaction we have seen granuloma formation. That granuloma formation will fall under type 4. Okay, now let's see the individual types. Okay, first how to remember the type. What is the mnemonic for here? Mnemonic is acid. Okay, A for type 1, C for type 2, I for type 3, D for type 4. So for A it is anaphylactic. A. C cytotoxic, ACID, right? So A is type 1 anaphylactic, C is cytotoxic, that is type 2. Here is I and D. Okay, ACID. A was type 1, type 2, type 3, type 4, and this is immune complex mediate, stand for type 3, and type 4 is delayed type. Okay, so acid is the mnemonic to remember the types of hypersensitive reactions. Now we will see individually what are the examples. Okay, so coming to type 1 hypersensitivity reaction, right? So in type 1 what we have? In type 1 it was anaphylactic reaction, that is IgE mediated anaphylactic reaction. So what are the example? Eczema, hay fever, asthma, atopy, urticaria, anaphylactic shock, acute dermatitis, and one test will be here, Cassoni's test. Okay, we will discuss it later on, just now remember the name. Cassoni's test falls under type 1 hypersensitivity reaction. Okay, then comes angioedema and the parasitic infections. So all this will be IgE mediated reaction, so they fall under type 1 hypersensitivity reaction. Okay, type 1 hypersensitivity reaction. So let's discuss the mechanism once again. Type 1 hypersensitivity reaction is associated with the production of IgE antibody, okay, which will lead to immediate release of vasoactive amines and other mediator from mast cells. See, so the cells involved are mast cells, so that will later on recruit other inflammatory cells, so it will lead to anaphylaxis, allergies, bronchial asthma, and everything else. Okay, now coming to Cassoni's test. This test is not used nowadays, but only for study purpose you need to remember this. Okay, so Cassoni's test falls under which group of hypersensitivity reaction? Type 1, right? Type 1. So it is a immediate hypersensitivity reaction skin test. Where do you do this? In hydrated cells. So the hydrated fluid is collected from animal or human cells, and then it's injected into the dermis. Okay, dermis of the arm. Then we can see a large wheal or multiple pseudopodium. See, a large wheal is formed. So this is a positive Cassoni's test. This test is outdated now, it's never done now, it was done previously. So only for study purpose we need to remember that Cassoni's test will fall under type 1 hypersensitivity reaction. So it will be IgE mediated, it will involve mast cells. Okay, now coming to type 2 hypersensitivity reaction. Okay, in type 2 what we saw, acid, ACID. So C was for type 2. C stands for cytotoxic hypersensitivity. Cytotoxic hypersensitivity is our type 2 hypersensitivity reaction. Okay, so it will be antibody mediated reaction will be there. So antibodies may be IgG, IgM, and other complement mediated also. Mostly it is IgG mediated. Okay, so now let's see what are the diseases in it. ITP will be there, autoimmune hemolytic anemia will be there, Goodpasture syndrome will be there, pernicious anemia will be there, acute rheumatic fever will be there, diabetic mellitus also there, and Graves disease and myasthenia gravis. You remembered it here also, but now these two diseases are shifted in type 5. Okay, why in type 5? Because type 5 is receptor mediated antibody. Where there is receptor mediated antibody occurring, they fall under type 5. So this is a new type found that which includes grave disease and myasthenia gravis, both the two grave. So gravis, Graves disease and gravis, okay, both to grave disease, they are shifted to 5. Okay, so in Graves disease, what is the receptor involved? That is TSH receptor is involved, and in myasthenia gravis it's the acetylcholine receptor involved. Okay, now we will see what other antibody mediated are there. In good pasture syndrome, it is anti-GBM antibody. Okay, in ITP, what is the antibody? It is a complex will be formed again GP1B by 9 and GP2B by 3A. So antibody against this whole complex will be there. Okay, in pernicious anemia, it is the intrinsic factor, antibody against the intrinsic factor will be there. Okay, now we will see a mnemonic for this, how to remember all the disease. First let's see the mechanism in details once. Okay, after that we will see the mnemonic. So there will, in type 2 hypersensitivity reaction, there will be production of IgG and IgM. So these antibodies will bind to an antigen on the target tissue and target cells. This will lead to phagocytosis and lysis of the target cell by activation of complement system. Okay, so now coming to the mnemonic. What's the mnemonic for type 2 hypersensitivity reaction? The mnemonic is my blood group is Rh positive. Okay, so my stands for myasthenia gravis. Blood group is for the blood transfusion mismatch reaction. So blood transfusion mismatch reaction falls under type 2. Okay, then group is for Graves and Guttpasser syndrome. E is for immune hemolytic anemia, and RH is for rheumatic heart disease. Positive is for pernicious anemia and also pemphigus vulgaris is a skin disorder. So there also what type of reaction we see? Type 2 reaction we will see. So what is the mnemonic? Once again, let's see. My blood group is Rh positive. You remember this myasthenia gravis and Graves disease in type 2 only, but recently they have been shifted to type 5. Recently they have been shifted to type 5 of hypersensitivity reaction. Okay, otherwise you mention it in type 2 only. Okay, now coming to type 3 hypersensitivity reaction. Okay, so type 3 reaction was ACID. So I is my type 3. What was I? Immune complex mediated hypersensitivity reaction is my type 3. So what all will be involved here? IgG, IgM, complement body, and also leukocyte mediatum. So let's see what are the diseases involved. Diseases will be rheumatoid arthritis, SLE, then it will be lepra-2 reaction, and also like post-streptococcal glomerulonephritis. We'll see a mnemonic for this also, and also another test will be there, that is Schick test. Cassoni's test, where did you see Cassoni's test? In type 1. In type 3 it is Schick's disease. Schick's test is in type 3. Cassoni's we saw in type 1. That was for hydatid cyst. Okay, so now first let's see the mechanism of the type 3 hypersensitivity reaction. What is the mechanism? There will be antigen antibody antibody complexes, antigen antibody complexes. So that will be deposited, that is deposition of antigen antibody complexes will occur, that will lead to complement activation, and further it will recruit the leukocytes and the by complement products and FC receptors. So there will be release of enzymes and other toxic molecules. So it's mainly the immune complex deposition will happen, which will further lead to complement activation and other things. Okay, so now let's see the mnemonic. Mnemonic is sharp. For 3 it's sharp. Okay, S for SLE or serum sickness, H for Hennex colon purpura, A for Arthur's reaction, R for reactive arthritis, P for post-streptococcal glomerulonephritis. So what is the mnemonic? The mnemonic is sharp. S for SLE, H for Hennex colon purpura, A for Arthur's reaction, R for reactive arthritis, P for post-streptococcal glomerulonephritis. Okay, now let's see the Schick's test. What is the Schick's test? Schick's test, here we use diphtheria toxin. Diphtheria toxin is injected intradermally. So here the reaction is seen after 2 to 4 days. If there is a wheal or some reaction is there, so we call it positive test. This test is also not done nowadays, it's just for study purpose only. Okay, so Cassoni's test what we did for hydatid cyst, and Schick's test we use the diphtheria toxin. Okay, so now coming to type 4, that is delayed hypersensitivity reaction. Okay, type 4 is for delayed acid. So last one is D, that is delayed hypersensitivity reaction. What was it mediated? It was T cell mediated reaction will be the type 4 hypersensitivity reaction. So what all falls over here? Tuberculosis, sarcoidosis, contact dermatitis, granuloma formation, and also type 1 lepra reaction, and psoriatic arthropathy. So type 2 lepra reaction we saw in 3, and type 4 is in type 1 is in type 4 hypersensitivity reaction. I'll say a mnemonic for this also, okay, later on. So another 2 tests are also involved in type 4, that is tuberculin test and the lepromin test. Tuberculin test and lepromin test will fall under type 4 hypersensitivity reaction. Okay, let's see the mechanism first. So what is the mechanism? There will be activation of T lymphocytes will be activated. Okay, then there will be release of cytokines and other inflammatory bodies, which will later on lead to macrophage activation will be there, and there will be T cell mediated cytotoxicity. So here the example will be contact dermatitis, tuberculosis, granuloma formation, and all this. Okay, so now let's see the 2 tests. Tuberculin test, how is it done? That is our Mantoux test. Tuberculin test, also known as Mantoux test. So tuberculin, see here there will be, we inject intradermally tuberculin substance, and then there will be inflammatory response of the lymphocytes. Okay, T cell mediated response will be there. So After 2 to 3 days we will check for any induration. Here induration will happen, induration we'll see, and it is measured using a calipers to note the exact size. Okay, so according to that size we say it is positive or negative. Okay, so it will be read after 2 to 3 days. Why so? Because it is a delayed type of reaction, so we can't see the immediate reaction. In Cassoni's test we used to see a will, we could see a will, right? Will which we would see immediately only, but here there will be induration. See, here an induration will be formed, and it will be seen only after 2 to 3 days, Now for the lepra reaction, one mnemonic I'll say. See, lepra reactions, there will be rule of 5. Okay, the addition should be 5. So for type 1 lepra reaction and type 2 lepra reaction, type 1 lepra reaction will fall under which hypersensitivity? Type 4. So the addition will come to 5, right? And type 2 will fall under type 3. So again the addition will come up to 5. So in lepra reaction there will be rule of 5, that is type 1 will fall under type 4 hypersensitivity reaction, and type 2 will fall under type 3 hypersensitivity reaction. So both the addition are equal, that is 5. Thank you for watching. I hope you found this video helpful. Do like, share and subscribe to this channel to get more videos of this kind.